We actually performed our first adolescent surgery in the mid-90s. We had parents coming to us who were desperate to seek help for their kids who are morbidly obese. If you've got a morbidly obese 13-year-old at 300 pounds with diabetes and sleep apnea, then the future for their health is abysmal. So we had the parents and adolescents coming to us who were desperate for help. So we started basically offering that service. Never really expanded on it or did too much with it, but the word was that we would accept anybody basically from 13 upwards. And during the 90s we performed dozens of procedures on adolescents, and they were all gastric bypasses at the time. All of those cases up until 1999 were done with open surgery, so it was difficult to get adolescents to understand that they were going to be in pain and so on. And then in 1999 things changed when we started doing these procedures laparoscopically, and we carried on. Recently, of course, the sleeve gastrectomy has become probably the procedure of choice for most adolescents. It's the commonest procedure being done throughout the United States right now, but it leaves several options for adolescents, and we like offering that procedure to adolescents. Again, if it's all very tailored towards what comorbidities the patients have. If we have an adolescent who's got a very high BMI and has bad diabetes, then we'll offer them a gastric bypass. But it's nice to be able to offer a sleeve, and we've done probably I would say between 15 or so sleeves or thereabouts on adolescents over the past several years. But again, most of the patients that we've done have been gastric bypasses. Luckily enough, we have not had anything in terms of major complications with these kids, and you know, they've all gone on to lose weight, and most of them have done very well and kept their weight off. It's a huge problem with adolescents, of course, going off to college. Many of the kids we have done over the years have been seniors in high school, getting ready to start their college careers, getting ready to launch themselves into the workforce. And they've come to us desperate because, of course, everybody knows that if somebody shows up for a job interview, there's immediately a level of discrimination against people who are morbidly obese. Recently, however, the American College of Surgeons with MBSAQIP has instituted a certification process for centers performing adolescent surgery. And we applied for that given our past history with performing these procedures in adolescents, and we are now the only center, I believe, in the area and probably in the region that has certification for adolescent surgery for weight loss. This fits in very well and tailors very well, of course, with the fact that we have the only children's hospital in the region, and we partner with the Child Life folks over at the Children's Hospital to provide services to the adolescents when they come for surgery. Sleeve gastrectomy is a great option for adolescents who are still in the phase of growing. There's less in the way of malnutrition problems with the sleeve, less malabsorption problems, because the sleeve is an operation which really reduces the size of the stomach and does not interfere in any way or manipulate in any way the small intestine like the gastric bypass does with a Roux-en-Y and a limb taken up to a small gastric pouch. So it's a tremendous option. And the other thing about the sleeve is that if the sleeve long-term fails, and let's say an adolescent 20 years down the road starts to put on weight, there are options for converting it to another procedure which can, you know, ensure more weight loss over time. So it's a great option. We don't just perform bariatric surgery, we're a bariatric surgery program. So we have registered dietitians, we have a coordinator, we have a physician's assistant, we have a host of people who are expert in helping patients achieve their goals, and more so than ever with the adolescents. Of course, we have Heart Health here too at MUSC. So we make sure that they take their vitamins, we make sure that they eat the appropriate amount of protein, we make sure that they stay hydrated. We have an adolescent buddy list where if an adolescent is interested in surgery, if their family are interested in them having surgery, they can contact another family maybe who have had the surgery in the past and speak with them. but we offer a wide-ranging service. The surgery is just a tool, and the surgery actually is the easy part of this entire process. The hard part is the dietary efforts and afterwards, and the maintenance of the appropriate dietary intake.